Hello, my name is Dr. May. I welcome you once again to our lecture series. I want to express my gratitude to all of you, all those who sent in their questions and comments, telling us their experiences about chronic joint pain, asking questions. In fact, it's from your question that we needed to do this lecture, because some of you have asked, Doctor, for your last lecture you what to talk about the use of painkillers. Does it mean that one shouldn't use painkiller anymore? Okay, so that's what I came here to explain. All right, so when we talk about NSAIDs, we are talking about the painkillers. So the aim of this short lecture today is to tell you about the safe use of painkillers. Yeah, painkillers can be abused, and when one abuses it, it becomes a health hazard to us. There are reasons why we use painkiller or we use these drugs. There are three properties these drugs have that make the doctors to apply them in certain health conditions. One is they have this analgesic property, which means they have the capacity to reduce pain. Okay? They also have the capacity to reduce temperature, what we call antipyretic property. And they also can reduce inflammation by acting as anti-inflammatory drugs. Okay, so it's because of these properties that we use them in medical practice. And when it comes to chronic joint pain, or otherwise known as arthritis, it's because of its capacity to reduce pain and to reduce inflammation that doctors use these drugs in arthritis. But unfortunately, these drugs were being used because it was erroneously believed that arthritis was practically only inflammation of the joint. So that's why these drugs are like number one drugs that we are commonly used for this kind of condition. But as we know today, arthritis is not only inflammation of the joint, but degeneration of the joint. So if you are using these drugs for chronic joint pain, one has to use them with caution. Okay? So, and these are the drugs we are talking about. Okay? So the idea of bringing this slide is to show us what is known as the maximum daily dose. The maximum daily dose for ibuprofen is 1,200 milligrams. You shouldn't exceed that in a day. Of course, we know ibuprofen comes in 200 milligram strength and 400 milligram strength. So if you are taking 400 milligram strength 3 times a day, morning, afternoon, and evening, you are covered the maximum daily dose. But unfortunately, people take 2 of that, which is 800 milligram 3 times a day, taking it up to 2,400 milligram per day. Okay, and some other drugs, naproxen, which comes in 500 milligram, you shouldn't take more than 1,500 a day. Okay, diclofenac, which comes in 50 and 100 milligram, one shouldn't take more than 200 a day, and all these other painkillers. But what concerns me most in these drugs is that because of our common practice of recommending drugs or taking recommendations from everybody, son, daughter, relatives, friends, oh, this is the one I used the other time and it worked. So by the time 4 or 5 people recommend drugs that worked for them, you yourself might not know that you are using a particular drug. For instance, diclofenac comes as Voltaren sodium, it comes as Voltaren potassium, it comes as diclomol, it comes as lofenac, and in different brand names. So when these people recommend to you, they recommend to you based on the brand names, and you, not knowing, might be buying all these drugs and taking them at the same time, not knowing that you are taking one particular drug in different brand names. And by so doing, you are putting your body in danger because you are exceeding the daily maximum dose. Okay, so also other drugs like ibuprofen comes as Advil, Motrin, and there are other local brand names they come in. And when you have all these combinations of brand names, it might be running the risk of taking a particular drug in different forms, and by so doing you are exceeding the daily maximum dose. And when you're exceeding that maximum daily dose, you are putting your stomach, your kidney, and your heart in danger. Okay? Apart from the dosage, another question is, Doctor, how long should I use these drugs? What's the safest length of time one should use these drugs? Okay? So depending on what you're using the drugs for, if you're using the drugs for fever, you shouldn't use them use it more than 3 days. If the fever doesn't get better by that time, you have to take it a step higher. So also it's for pain, like the joint pain and all that. You can't use these drugs for more than 10 days in a stretch. If you have need to take them for more than that 10 days in a stretch, you need to see a doctor. So taking them beyond this recommended time should be based on doctor's recommendation. And usually these companies, the pharmaceutical companies making these drugs, are usually asked to warn the patients, put a caveat in the packs of this drug that you shouldn't take these drugs on your own beyond this number of days. That's why we hear a common balance that says if after 2 days you know better, see your doctor. And that balance is made for a particular drug for pain and for fever. Okay, so this should apply to other painkillers as well. If you take them for some time and what you are taking it for is still coming up or is not even getting better, it's high time you stepped up your quest to solving this pain by going to see your doctor. Okay, so when you go to see your doctor, it is the function of your doctor who looks beyond the symptom, because when you come to the doctor you complain of pain, which is a symptom, but the doctor needs to find out what is causing the pain, and what is causing the pain is the disease, because when you heal the disease, the symptom will do what? Will disappear. So that's the function of the doctor, and especially for those who have chronic joint pain, to make that diagnosis after the doctor has examined you and listened to your history, for the doctor to be sure of what is really behind the pain, the doctor will send you for what is known as diagnostic test. And for chronic joint pain, the major diagnosis tests are the imaging tests that bring out the picture of your joint and helps the doctor to see what's going on inside your joint. He can either send you for X-ray or for CT scan or for MRI. Okay, so when you bring this result back, the doctor will now look into the result and see whether there's any degeneration. And degeneration means damage of the ligaments and cartilage and other tissues of the joint when they have started going through wear and tear process. It's the wear and tear or this damaging process that is giving you the signal of pain. The more the wear and tear, the more the pain. Okay, so if you abandon the wear and tear, you don't care to find out what is causing the pain, and you are tackling the pain with painkiller, you are actually doing the wrong thing. So the doctor reviews it. Oh, there's degeneration going on, and will now tell you the extent of degeneration you already have. So if the doctor have made the diagnosis of degeneration, which is what we commonly call arthritis, the doctor should not go back to continue to give you painkillers, because that painkiller will not work. It will not sort out the degeneration. Okay, so what the doctor needs to do is to give you a treatment that will regenerate the damaged ligaments and cartilage. If the ligaments and cartilages have degenerated, they need to be regenerated, which means to repair, to restore, to heal back to normal. Okay, and these are treatment options one would naturally use to regenerate the cartilage and the ligaments, which platelet-rich plasma, which is the treatment in which the doctor takes your blood, just like the way we take blood when we go for lab tests, spin the blood to segregate the blood and get the part of the blood that is plasma, that is rich in platelets. So this treatment is very wonderful because the platelets themselves contain the growth factors that have the capacity to regrow the ligaments and the cartilages and restore your joint back to normal. Okay, this can restore the joint back to normal 100% depending on the stage of the degeneration in which you presented. If you present early enough, you stand up to 75 to 80% chance of permanent restoration and regeneration of your joint. Okay, so this regeneration is also carried out using prolozone therapy, which is where we use medical grade oxygen and ozone to heal the joint. So also is called laser light therapy, which uses the laser technology to penetrate into the joint to encourage the healing of your joint tissues and all that. So also is prolotherapy, otherwise known as prolotherapy, also known as dextroprolotherapy. Okay, so all these treatments, sometimes in single or sometimes in combined form, helps to heal the joint. So if you are interested to get the joint pain to stop, you have to heal what is causing the pain. You don't get the joint pain to stop by taking painkiller. If you kill the pain, as long as what is causing the pain is still there, the pain will keep on coming up. Even at a point, the painkillers will no longer work. But what bothers us most is, as you are continuously trying to kill the pain, all those painkillers are continuously harming the organs of the body, like your stomach, causing stomach ulcer, and sometimes it can predispose one to bleeding stomach ulcer, and that is very dangerous. It can affect the kidney, it can affect the heart. So it is not very good seeing a whole lot of people dependent on painkillers. And sometimes when people come to a clinic, they come with bags and bags of drugs they have been taking for years. Okay, so this is a very wrong practice, and that's what we meant by safe use of painkiller. There is a safe use of painkiller, and don't just buy these drugs on your own and be using. Let them be recommended by the doctor, and most importantly, don't continue taking painkiller thinking that they're going to sort out your chronic joint pain. Do regenerative therapy to be free from chronic joint pain, otherwise known as arthritis. Thank you very much, and keep the questions coming. Your comments are highly appreciated, and that will be guiding us in bringing more lectures that will help you to understand what to do, so that at the end of it all, every one of us will be happy living pain-free. See you again in our next lecture.